everybody. A very warm welcome from Heather Lockett in Lasting Conversations. We're talking women's health today, women's health, wholeness, endometriosis, and all wonderful things with world-renowned specialist Dr. Iris Kerin Orbuch. Hi, Dr. Iris.
Hi, pleasure to be here.
Thank you so much. So we were just chatting away as we're getting set up here, and it's our first time meeting, but I know the universe has conspired for this very moment, talking about women's health, and is very, very vital and important in the empowerment of our bodies. And sometimes we've been carrying mysteries of pain and suffering that have shown up in all kinds of symptoms, and we've been lost or maybe even gone doctor to doctor. So Dr. Iris is here to help us navigate so many ways to help and become healthy. So welcome. And Dr. Iris is a best-selling author of a wonderful and helpful book called Beating Endo, How to Reclaim Your Life from Endometriosis. And also, she was part of a fabulous PBS documentary book called Below the Belt. So once again, Dr. Iris, please share away all the fabulous things that you do. And especially you specialize in a very specific laparoscopic surgery. So you wear many hats, all of which have to do with health and wellness.
Yeah, so I guess my goal or my mission in life is to help so many who are suffering. And what endometriosis is just such a devastating medical disease that affects almost 200 million worldwide. And it's so unfortunate in the US, patients go on average of 8 to 10 years from symptom onset to diagnosis. And they see on average of 8 physicians over that course of the decade until they're diagnosed. And then what's even worse is once they're finally diagnosed, they have the wrong surgery. So endometriosis is incorrectly thought of as like a menstrual disorder or a period disease or just bad periods, but it's really a systemic, meaning whole body, inflammatory disease. And, symptoms can range through a whole spectrum of organ systems. So from a gynecological perspective, and let me kind of in parentheses say some patients may have one of these symptoms, some may have none, and some may have every one of these symptoms. So from a gynecological perspective, symptoms of endometriosis could be painful periods, painful ovulation. It could be pain all month long. One could have infertility or heavy bleeding. So those are the gynecological symptoms. Most of my patients actually present with gut symptoms or GI symptoms like constipation and or diarrhea and or alternating constipation and diarrhea, bloating, like being diagnosed as IBS, irritable bowel syndrome. Like, we don't know what you have. You've seen a GI and they're like, there's nothing wrong with you. You have IBS, like go on your way. And then some have urological symptoms such as painful urination or kind of feeling like they have urinary tract infections, but the cultures are negative, or urinary urgency, like I gotta pee, or urinary frequency. But basically what endometriosis is, so it's when we have cells that are similar to our uterine lining, which is our endometrium. That's the lining that every month gets thicker and thicker and thicker, and then we shed that lining when we get our period. It's when we have similar cells to that lining outside of or external to the uterus. So on a monthly basis, our ovaries are releasing hormones that are telling our uterine lining get thicker and thicker and thicker. And then if we don't get pregnant, we shed that lining and then we start that cycle over and over and over again. But the cells of endometriosis are there at birth. There was a study, and this is fascinating, where they looked at female autopsies and they found that 9% of female fetuses actually have endo. And that number is not too dissimilar than what we quote in the general population of 10% of those who have a uterus as having endometriosis. So we do know that there's a genetic component. If the mom, grandma, aunt has it, it could be coming from mom's side, dad's side. That affected child or fetus has a 70 to 100% likelihood of having it. And we also know that certain environmental toxins, like dioxins, we know, which are byproducts of bleaching, can affect the mom when the fetus is in utero and then cause endometriosis. So these symptoms are on, so for some people, they're there in childhood. I always had gut symptoms. I always had tummy aches. And for other people, it comes on when they start their periods. Other people, it's like in their 20s, other people in their 30s. It's different. And that's what makes the diagnosis so difficult. The varying symptoms that I had mentioned, again, you could have one or all of those symptoms, as well as we don't have a diagnostic imaging to pick up endometriosis. So, for instance, pelvic ultrasounds are normal. CT scans are normal. Patients are going to the ER in pain. Imaging's normal. Like enough is enough. You know, if this was like a man's disease, they'd figure out a way to diagnose it, treat it, you know. And I forgot to throw in one of the symptoms, painful sex. It could be on entry or deeper penetration. So, like, no offense, but if a man had difficulty with sex, they probably would find a solution to fix that pretty rapidly. So it's just devastating. So I've kind of dedicated my career, and I'm just so passionate to helping those who are suffering, like really, and that beat endo. And that's why when I wrote my book, I'm not trying to sell my book, but it's like this.
No, it's very helpful. I was just mentioning to you when I was looking at I don't have it with me right now. But it's a wealth of amazing information, because what you just spread forward for us in this amazing rat-a-tat-tat is extraordinary. And I'm having my own get out, like go figure moment, because my own personal assumption was, endometriosis, well, they have it, or it's just about pain, it's just about uterine linings. But you have just described a plethora, and that it can actually affect women of all ages. Myself being postmenopausal, can it affect women of all ages? And your answer would be,
yes, it can.
Absolutely. This is mind-boggling. So please talk about what is in your book and in the documentary as well.
So my life's mission is to help those who are suffering beat endo. And it's like how to reclaim your life from endometriosis. And it's because endo is an inflammatory disorder. Those cells that I described are outside of the uterus. And month after month after month, they're releasing inflammatory mediators that are going systemically, meaning from head to toe. They're going to the gut and causing intestinal issues, causing like leaky gut, to use kind of an Instagram term, in both the small intestine and large intestine. They're going to our endocrine system, increasing the likelihood of autoimmune diseases. They're going to every system in our body, lots of fatigue and exhaustion. And I set forth, I'm very Eastern in my approach, even though I'm like an MD, but it's like a multidisciplinary East meets West approach, how to reclaim your life. And it goes into everything from gut stuff, mind, body, products that are good for the house, because so much crap that's sold are endocrine disruptors, which kind of, it's like fuel to an inflammatory disorder. So it goes through so many different things. This book could really be applied to any autoimmune disorder. And we know that autoimmune disorders are just on the rise across the world and in the United States. So it's really how to beat this disease. The cornerstone, I had mentioned that patients often go on average of like 8 to 10 years until they're diagnosed. I still see patients going 20, 30, and I'll get to your menopausal question in a moment, 20, 30 years until they're picked up. And essentially, it's like, how can we help these patients like really live their lives to the fullest? And plenty of menopausal. I've operated on 50-year-olds, 60-year-olds, and it's like a lifetime of misdiagnosis. And it's such a shame, because everything that I learned in residency and medical school about endometriosis was either false or outdated. And those same things are still being taught today. So including the surgery I learned how to do in my residency is the wrong kind of surgery. I then did a fellowship in minimally invasive surgery, and my focus, all I do is endometriosis from a minimally invasive platform, whether it's laparoscopic or robotics. They're just kind of advanced platforms. And it's crazy, because the cornerstone of treating endo is a particular surgery called excision of endo. That means like cutting out that inflammatory tissue that's wreaking havoc throughout the whole body. And what 99% of OBGYNs are doing is the wrong surgery, known as burning endo or cauterizing endo or lasering endo or burning endo. That is the wrong surgery. So if I can kind of explain it to people who are driving in their car and they're listening about endo, if you imagine your entire fingernail is a piece of endometriosis, and that's releasing month after month, year after year, inflammation to your whole body. Excision of endo would be cutting out the entire nail. That's removing it. It's excising it and kind of putting the anatomy back wherever it is. Endo could be found in the lung, in the diaphragm, really anywhere in the body. It doesn't only have to be near the uterus or the ovary or the female organs. Ablation would be burning just the white part of my nail, that top part that we like clip off or we cut off. So that's leaving behind all of this inflammation that then continues to cause problems. Patients are like, I don't understand why I'm not better. This medical gaslighting continues. The docs are like, I don't know why you have pain. We just did surgery. And they're like, it's like this invisible disease. And it's like, it's so devastating because those suffering are not living their lives to the fullest. It's so heartbreaking for me to witness. And that's why I have like dedicated my life to helping those in a really compassionate and empowering way beat this disease and understand it. And it's like, when something has been going on for 10 years or 20 years and they come into my office, yeah, the cornerstone is removing that inflammation, but we have to undo everything that came before them walking into this door. We got to revamp their gut. We got to get them into meditation, mindfulness. I am not saying meditation, mindfulness treats endo. I'm saying we have to undo this like sympathetic overdrive, adrenal fatigue, their body's just like not functioning properly. We have to fix everything from the inside out and then give them a great surgery. And that's how I get them, to like literally live their lives.
I mean, wow. And perhaps working backwards a little bit, I think where you were talking about the meditation, because when you're on this merry-go-round for years, and half the time the establishment or that you start to think you are crazy.
Yeah.
Right.
Yeah.
And it's disheartening and it's depressive. And maybe some doctor said, well, let's just get a hysterectomy. So now you've had, you've had half your womanhood removed. And maybe that's protocol for many things. However, but that mental toll is so exhausting.
Yeah.
It's so exhausting. And so perhaps and who would have thought, well, maybe my IBS symptoms. So now go through this whole thing of your food and your food and your food, which can be a whole roller coaster right there.
Yeah.
But if it's not even that, if this is a cellular thing, that is extraordinary to me, Dr. Iris. I mean, seriously, this is extraordinary because it's so vast.
Yeah.
And so no wonder it's been mysterious. And I think within, I want you to continue where you're headed, but in the back of my mind, because clearly you are a new age, you are revolutionary. So here's what you were learning in medical school. Okay, cool. But now it's time for something completely different and new advances, right? Yeah. And within that too, perhaps are there the genetic testing? How is it that you can get to the root and see exactly what's going on where others?
Yes. So I want to just go back and touch on the hysterectomy because just before I even talk about hysterectomy, I want to define it because I find that most people don't know what hysterectomy even means. So hyster by definition means uterus. Like they used to say, those who had our period, we were hysterical. So hyster means uterus, ectomy means to remove, like appendectomy, removing an appendix. So hysterectomy only means removing a uterus. That is not treatment. That is a myth of treatment for endometriosis. Because as I mentioned earlier, endo by definition is outside of the uterus or external to the uterus. So removing someone's uterus is not the treatment for endometriosis. We have to clarify that. Yeah. And those with endo can have endometriosis symptoms confined to the uterus, in the muscle of the uterus. That is given another name. That name is adenomyosis, okay? Those patients can also have the same symptoms that I described above. They also can have like a pelvic heaviness. It's usually midline, a lower sacral backache, and heavy periods, like really heavy periods, almost hemorrhaging. You don't need to have any of those symptoms, but definitive treatment for those patients would be removing a uterus or hysterectomy. That's definitive once they're done with childbearing. So there's so many myths to endometriosis, like pregnancy cures endometriosis. No, it doesn't. Hysterectomy cures it. No, it doesn't. Like, these things couldn't be farther from the truth. So to answer your question, like, kind of guide me. I was thinking of that when you were speaking.
Yes,
kind of guide
perfect.
Me exactly.
Well, it gets into how do people can find you, but even before that, how is the diagnosis made? And I think I was mentioned because it's so cellular, the whole genetic testing, the genetic component, the DNA tests and things like that. This is the newer sciences.
We don't have that yet, believe it or not.
So, they'll be coming with the next couple of generations.
Yeah. But we don't even need it. All we need to do is listen to a patient. I can tell on consultation, and I do consults across the world virtually, I can tell on consultation with a 90% likelihood whether the patient has endo, because I know the right questions to ask. I review everyone's medical records, and even if they have no medical records, we do it's like an hour and a half, very detailed questioning. And I can tell just with questioning. I think doctors these days don't know how to think anymore. And we're like, let's send for a test and get all our answers there. And it's such a disservice. Like, we need to use our brains and think. So I don't need a genetic test, to be honest. So what you need is a thoughtful question. I need to listen to the patient. And then we need to know what endometriosis looks like. So in my first week of fellowship, I remember I was trained by these two amazing leaders in the field. My first week of fellowship, they're like, oh, endometriosis can be blue and red and yellow. Like, they're showing me all of these patients, and clear and white, and it looks different in teen. And I'm like, oh my God, I've seen all of this before. And the doctors told the patient this was normal. And it's like, most generalists do not know what endometriosis looks like. They only know two appearances of a plethora of endometriosis. So if you end up having surgery with a generalist, and God bless a generalist, they do, from delivering babies to first sexual experience, how do you install a car seat, to menopausal health, to and like, their breadth is so wide, but the depth is very shallow. Like, God bless them. Like, I could never do that. I do one thing, so my depth is very deep. I read all the literature. I go to the conferences. But 99% of patients are going to a generalist for their endometriosis. Like, I was prepping for my patients this morning. I'm reading a generalist notes going back years and years and years and years. And I'm like, you should have picked this up on her first visit. And so it's so devastating. So I also love the minimally invasive surgery, which is like laparoscopic surgery. I do an advanced platform of laparoscopic. I do robotic surgery, which is 3D high definition. Laparoscopic is amazing as well. I love robotics, and I can see things that, my eyes see things that, for certain, a generalist doesn't see. Like, I can look at pictures of a surgery. A patient comes in, it's like, my doctor told me there was nothing there. I just had a ton of adhesions. And I pull up the pictures. I'm like, there's endo. They're like, then there's.
Well, this is great, because you're like an endo savant, and it's where you can see things where others can't. That's beautiful and amazing.
I want to touch on also the trauma, because as I'm looking at the pictures, the patients are crying. There's tears of utter sadness, of life loss, and utter joy that they finally have answers. And I think the next book that I write will be, I hope I have time to write it, but with all these new things that I have coming down the pipeline, but I do want to talk about the medical trauma, the gaslighting, the being told, like, if someone walks into a gynecologist and saying, like, I want to be intimate with my partner and I can't be. And the doctor says, well, drink a glass of wine before you have sex. And it's so, like, I was going to use an expletive. It's so dismissive to a patient, and then they're like embarrassed, and then there's shame, and then they're like, my pain isn't real, and then it just gets deeper and deeper and deeper, and like, they should be able to be intimate with their partner. Like, it's so beautiful. So there's so much devastation. Then that, let's say, goes into exacerbating depression or anxiety or prior traumas. Then all of that increases a patient's pain. Then all of that slows gut function. Then all of that worsens leaky gut. Then all of that causes more, let's say, constipation. Then all of that causes the patient to strain on the toilet and causes further pelvic floor tight muscles are gripping and squeezing. And then it's just like this vicious cycle that is so unnecessary. Yeah.
So unnecessary. This is where, to rewind, to just peel back the onion in one fell chop. It feels like that's what you're doing, is that, and there's a freedom to that, the utter freedom of knowing, oh, I don't have to live like this anymore. Yeah. And, life comes down to fear or joy or fear, but because everything you were just describing gets into fear spaces and the what ifs and the what ifs. And this once again gets into your 360, the wholeness of a person. Mm-hmm. And where I know the medical establishment, again, God bless them, it's gotten very, it's very technologically wonderful. And yet, where has the human gotten lost in it? Yeah. That human touch, and people do not have time when it's 10 minutes, a 15-minute appointment has 6 people booked at the same time.
And not only that, there's a computer screen in between the doctor and the patient. They're not even looking at the patient. It's just, it's just all wrong.
It's just all wrong. So tell us, let's go there now, unless you have a different branch you want to get into, but it probably all goes together. So this all wrong. And as an iconoclast, as a ball buster and a visionary, you're here to reestablish. Maybe did you invent this new specific procedure because of your gifts, or you've had training? I mean, who amongst your team is here to literally revolutionize and rethink the whole shit show? I will say it, the whole scene, whole scene.
I was really lucky to be trained by C.Y. Liu and Harry Rich. They were the two visionaries who really paved the way for me from a surgical perspective. So beside being mentors to me, and I was one of their last fellows, just a beautiful relationship. And they really passed on, they saw my passion. So from a surgical perspective, I learned how to do the surgery. And mind you, there's only handfuls of physicians across the country. There's not many people who do the advanced surgery that I do. So I owe a huge debt of gratitude to them. But what I did with all of that was, I'm a questioner. I'm this doesn't make sense. I'm an outside the box thinker. I'm put me in a box and I'm going to be find my way to get out of that box. It was very hard for me.
That's why we're talking. This is great. Yeah.
It was very hard for me to even be in medical school and do residency. And because it's so formulaic, so box, they try to remove the way that I think, and I think in a really abstract way. And I remember I was invited to give grand rounds where I did my residency. That was at Lenox Hill. And this was maybe not even 6 months after I finished my fellowship. And I was reading all of the literature on endo, to put the specifics in my grand rounds. And there was one sentence in one paper by Dr. David Redwine, who passed away maybe about 1.5 years ago, 2 years ago. He was a mentor with the 2 mentors. It was the 3 of them were the giants in the field. There was one sentence in that conclusion of one of his papers that said, there may be another etiology for pain. And it just stuck in me. And I'm I wonder what that is. And I started and I'm just very yoga, mind, body, triathlete. I eat organic and clean. And that's just my background. And it's been more and more over the last, 20 years. And I started to see these similarities in patients, with the gut stuff. And I'm well, first I actually started collaborating with pelvic floor physical therapists, because I realized on physical exam, my patients had really tight pelvic floor muscles and they were always gripping and squeezing. And so that's why there's in my book, there's another author, Amy Stein, who's an amazing pelvic floor PT. I reached out to her when I wanted to write the book, met her for coffee, and I'm Amy, we got to write this together, because 99% of my patients also have pelvic floor tight muscles. So it's not PT shoulder knee PT. It's someone who's specific for pelvic floor to release those muscles that are gripping and squeezing in response to pain, or gripping and squeezing in response to the uterus or the pelvic organs being pulled this way, or typically to the back. And so then I started collaborating with pelvic floor PT. And then I started seeing all of these urological symptoms, and I started working with urologists who were like-minded. and realizing that there's a huge association between this entity called painful bladder syndrome or interstitial cystitis in those with endometriosis. So I started treating them in my way with that. And then I started realizing that the central nervous system is like literally on fire in these patients. The patients would report burning symptoms or shooting pain symptoms, or I would just go to touch their belly, just touching their skin caused them to jump. Not everybody, but some patients. Right. So I started like with pain doctors, not narcotics. Narcotics are awful for endo, but other medicines to downregulate that. And then I started working with physiatrists. Like, what can we do? Injections into the pelvic floor. And then I started working with acupuncturists. And then I started working with, like, getting more into meditation myself and mindfulness. Then I started realizing the connection between trauma, getting all my patients who either had prior trauma or have gone years being told there's nothing wrong with you, getting them into therapy. And then I started getting involved in somatic therapy and realizing these patients were storing their traumas in their muscles, and we had to deal with that and you know, and it's just, then I realized it's lifestyle, and then I realized it's the food we're eating, and then it's the products we're putting on our body. And it's all of that. So that's why I love all my patients, but like my favorite patients, usually when I treat a mom, if she has a daughter, she'll end up bringing her daughter in like right away when she starts having either stomach aches or gets her period and she has pain. I love that because I'm not then undoing 30 years like I had to do with her mom or her aunt or her grandma or whatever. I get to, you know, often it's undoing even a couple of years or a couple of months. It's too much at that point, but it's not the 20, 30 years. And it's like, it's so amazing to be able to, so my mark on this field has certainly been the multidisciplinary East meets West approach. And it's been challenging because I'm part of a surgical organization. I'm a doctor. And it's like, they didn't want to hear anything that I had to say. It's like, I was a salmon swimming upstream for all of these years, and I knew my knowing, and I trusted my intuition, and I kept doing it despite like people being like, you know, my patients get better. And then I'm like, I got to get this book out. I got to like make this available to more people. And now like surgeons are like, oh, my surgery didn't help, go to pelvic floor PT. Like, okay, at least they're talking about,
right.
Like, give them a prescription before they even get to surgery. Like, but there's a change happening. And then I think with the movies, I was collaborating with Shannon Cohn, the producer. I think we've been collaborating like 15, 16, 17, 18 years already, trying to like look at this problem and solve it upside down and backwards, because going through the medical community doesn't work. They're still teaching outdated information. However, we are getting into medical schools now. There is nurses, like medical education that we're doing. We have like a program where we've put in, I forget, I'd have to ask Shannon, but I want to say like over 5,000 school nurses have been educated about endo to raise awareness about that. And the movie, her first movie, which I was a part of, which that's like really what excited me, which is called Endo What? Like, because people are like, Endo What? Endometriosis. Like, endometriosis wasn't even a household name like it is now. So that came out, I think, 2015. And we had been working on that for so many years before 2015. So that was like the first. And then I want to say maybe in 2022, the second movie came out, and that's where we had a lot of big names. Like we had gotten bipartisan funding support from Congress. Hillary Clinton was one of the executive producers, Corinne Fox, Rosario Dawson, and Mae Whitman. And that movie, Below the Belt, has gone across the world, literally, and showings. And that is where I think it's like now a runaway train. And it's like either jump on or like get off. Like it's moving, and it's moving because it's patient driven. And so what was once an uphill battle, it's like, and I fought for so many years, now it's like, oh, this makes sense, you know?
Right.
So, yeah.
Well, and now it's game on in terms of having that focus instead of having to chug this way up the Matterhorn.
Yeah.
You're just going now. And I love that you said it's patient focused. So, everything starts from the groundswell up, with visionaries like yourself to pave the way. And so, to have the documentaries, and we'll talk about that towards the end of our show here, where to find these resources. But the other thing that comes to mind within the system. So if now, if the medical establishments can begin to have the conversations, right, and begin to perhaps teach new ways, that will be coming up, which is great to start. My other piece of the question of that is how are people paying for this? Because you have not only what the schools are saying, but you have the insurance companies, what they do and don't want to pay for. Do you want to touch on that little hot topic a second? We don't have to, but it's part of the whole scenario.
It's important to discuss. What patients don't understand is that our medical community, and I've been trying my whole career to try and change the coding, and it's just like an uphill battle. Like an orthopedic surgeon can go in and do a 15-minute like cleaning out a knee and make probably 4 times what a 7 or 8 hour surgery that I would make. Like insurance companies think excision of endo is worth like $600 for like 6 or 7 hours in surgery. I'm often there 2 hours beforehand, and then that includes a 3-month global care afterwards. I can't even pay my staff, right? My secretaries, and I give them health insurance. Like I can't even keep the lights on in my office according to what they think. And by the time, because, this country is moving more towards chronic diseases, because we're not fixing patients from the inside out, we're band-aiding them, right?
Yeah.
With pharmaceuticals. And if I don't take insurance, because that's what allows me to spend the hour and a half with patients. But if I did, I remember when I did take insurance early on, and I would bill the equivalent of a 99215 or like a level 5 visit for a patient, because I had proper documentation. I'm spending an hour with the patient. The complexity is there. My biller was like, you can't bill that because you'll get audited. I'm like, but I'm doing that level of care. He's like, doesn't matter. Insurance companies are going to audit you for that. And I'm like, get me out of this system that doesn't work.
Yeah. Well, that they'll pay for the 10-year cycles of the merry-go-round. They'll pay for the stacks of labs and doctors and ultrasounds, but they won't pay for the route to get it done and dusted.
Yeah. So I've been fighting that for years. And unfortunately, so what I've been trying to do is like, we're just launching my new organization, and it's called Iris Wings Sanctuary for Endometriosis Surgery and Wellness. I'm building out a space here in LA, and hopefully it'll be done in about a couple of weeks. And I brought on an associate who's amazing, who has my same vision. I have an amazing PA, and it's like, we're trying to find a sanctuary where patients can come and feel heard and seen, where they'll receive expert endometriosis excision if that's what they need, and where we'll approach them in an East meets West multidisciplinary approach and help them like beat endo, right? And so that's the goal of my center. And, there's so many different things that under that realm that I'd love to do in the next 3 years, 5 years, 10 years, like more to come on all of that. But it's like taking people kind of under my wings and like making care more accessible to people. So it's been a lot of tiresome, exhausting work, but I love it.
That sounds beautiful. And I'm imagining, I'll put it out there. Are you going to have meditation room or spaces for people to be part of that within your center?
Not within the
or center. Referrals. You'll have referrals.
Oh, well, I've already do referrals, but I don't want to like say what I'm doing just yet.
That's okay. Yeah.
It is at a premium in Beverly Hills. If I did that, then I'd have to charge so much more.
Well, that's true.
And I don't want to do that. So I have like a workaround to all of that. But I get my patients on a meditation challenge on their first visit. Like that's part of what we do. But yeah, there's going to be a collective healing, but maybe you'll have me on in some time, and I'll describe all of that.
One thing at a time. Yeah, this is. So let's talk global for a moment, because this is a worldwide scenario, and the chronic illnesses. But one of my questions I thought of this morning has to do with, because if we're thinking about the food intake or what we, with air or plastics or all the endocrine disruptors, are there statistics of certain pockets of the world that it doesn't even exist, or it's not a thing, or in others that are horrible hotspots?
Yeah, that's interesting. I honestly don't know the answer to that.
That's okay.
But, I would,
because maybe there are genetic, components as well.
Yeah, there are. So I think it'd be really hard to tease out. Right. But there probably is some data. It's very hard because a lot of epidemiologic data is retrospective, and there's so many confounding things that I know we're getting more funding, like through the NIH, and they're trying to figure out a lot of this stuff. But I don't know. Like, the only endocrine disruptor that we've identified are dioxins that I mentioned before, which are byproducts of bleaching. But there's probably so many others that we haven't identified that can induce endo. So it's, I don't know that answer.
I think the other piece of my question has to do with, in other countries, are others also in your profession following suit? Is there a way of finding the proper diagnosis across Europe or in Asia or other parts of the world?
They have. So how do we diagnose it? I guess we'll talk about it first. So the way we diagnose it, I can suspect it based on that really in-depth history that I take with patients, like with 90% likelihood. My physical exam, I can also with 90% likelihood, but I don't even need a physical exam, because in the age of COVID, and actually even before it, because I started my practice in Manhattan, and then I was bi-coastal Manhattan, LA. So I had to kind of figure out, how do I ask the right questions to figure out on a virtual call whether someone has endo. So I was able to figure that out with 90% likelihood. But the gold standard, I'm very academic driven, to knowing whether someone has endo is at the time of surgery. So minimally invasive surgery, we see something that can look like endo, and it probably looks normal to most generalists because they don't know what they're looking for. Again, that's just because they have like a whole host of things they're trying to know. But it's excising, removing that area, sending it off to the pathologist. The pathologist looks at it under the microscope, and they say, yeah, these cells look similar to the uterine lining cells. Hence, you have the diagnosis of endometriosis. They're looking for something called endometrial glands and stroma. But the diagnosis is made pathologically at the time of surgery. And just about every patient's fear of mine as I'm taking them to the OR is, what if you don't find endo? And I'm like, that's what every patient's fear is. I'm like, I wouldn't take you this far unless I really thought I was going to find endometriosis. It's like the medical community makes us not know our knowing, undo our believing in our knowing. And it's so sad. It's so sad. So that's how we even diagnose endometriosis. And to answer your question, in Europe, there's some great centers for endometriosis. I don't think people are doing anything multidisciplinary, to my knowledge. Maybe they are, but there are some great surgeons in Europe. Because Europe does it right. They have centers for endometriosis where all of the patients are shunted to good surgeons. Whereas here, you could have someone who does two surgeries a year, and she or he is taking a patient to the OR. It's like, why is that even happening? But it is.
Wow.
Yeah.
And let's see, I know we're going to circle in towards the end of the conversation, which I think I would love to just talk with you forever, because it hits on so many buttons. It's so vast that getting into the hope and the empowerment, I think threaded through this whole story here that you're sharing with us is the sense of, it doesn't have to be this way. There is hope. There are answers and resources. So Lasting Conversations is usually all about finding resources for people to have a conversation and to find something that they need. So let's continue with that in terms of the hope and the empowerment for people.
Yeah, it's happening. And, I empower patients, that's for sure. And that's why I'm bringing on more people on my team so we can help more patients and then, hopefully continue the expansion. But what's happening is then I help a patient and they go on social media, they tell their story, then it helps other people, then they share. And, the good and bad with social media is dissemination of good information. Trust me, there's so much incorrect information online, there's more incorrect than correct information, which is doing such a disservice to patients, which is so upsetting. But more and more, there's more good information. So definitely, I think that there's more hope today than I had a year ago, more hope today than I had 5 years ago, tons more than I had many years ago. And I think I like to empower patients and validate them. And I think watching the movie Endo What, and then watching the movie Below the Belt that you can watch on www.belowthebelt.film. And it's starting this conversation, and then what patients are doing. Like, I have patients from Middle America, all over the place. They're walking into their gynecologist's office with my book and saying, I need a prescription for pelvic floor PT. I think I have this. I want a prescription for to be tested for SIBO, small intestinal bacterial overgrowth. And it gives patients, it empowers them, because when they're about to have surgery, there's a whole list of questions to ask your surgeon, to vet your surgeon, to see if they'll do a good job. So I do think that there is hope, optimism. I'm an optimistic human anyways. I see certainly the glass is half full, not empty. So yeah, I think we're moving in that direction.
That's great. I think you see the glass is always
full. Yeah.
Always full.
Yeah,
And this is a good round out to go a step further in terms of right now in the US, it's talk about a hot button. There are a lot of people who are afraid that they don't have access to female healthcare. Doesn't even matter what the hot button big thing is, it's any female healthcare. So again, from your perspective, taking our own power back and knowing that you're not alone. Would you like to touch on that part, that you're not alone? There are resources. Please reach out for help.
Yeah. And that's what I've been trying to do. And that's what these films do. And I've been part of the governmental organization, Society for Women's Health, I think research is what it is. And it's like, there is a big push even in the government for more money, for more research, for all women's health issues. And like, we still don't have enough funding. We're getting more, but it's honestly minuscule when this disease affects as many people who have diabetes, and we have like a fraction of the funding. It is happening. And what I always say to patients is know your knowing. Like, if you know you're in pain, keep searching for a physician who can help you, keep digging. And you really need to find a specialist. You really need to find an endometriosis specialist. And there's like a lot of great organizations. Like in the back of my book, I have like a whole resource because there's so much misinformation. There's pages upon pages of my vetted resources. I don't take money from anybody. I don't take drug company money. Like, I'm so pure. I refuse. Like, I could make so much money if I promoted these horrible medicines that are out there for endometriosis. But it gives like resources where you can find different people, and the ones that I think are good. So it gives patients like a jumping off point, like to know that I'm here with them. And the book is so validating. That's what every patient says to me. Like, I cried when you spoke about this particular patient. I saw myself as that patient. So then they're like, maybe I'm not alone. Like, you're 1 in 10. If you're in a room with 100 people, there are 10 other people who have endo. You are not.
Who don't even know it, who just don't even know it for decades even. Okay. Dr. Iris, is there any last nugget that you'd like to leave us with? You've said so much already, but is there one more?
Just repeating that excision of endo is the cornerstone of treatment. Not every patient, not every surgeon who claims they're an excision specialist is truly an excision specialist, not to add more complexity to this, but you really do have to do a deep dive, just like in everything else. Like I lived in Manhattan for almost 15 years. Why is it every corner of Manhattan? It's like best pizza in New York. Like, how are you all claiming that, right? They are, which is the best pizza in New York. And it's the same thing with everything. You really need to vet. And there's a lot of ways to vet in my book, but know your knowing, keep searching, find a specialist, and you can get better. Yeah.
Perfect.
Better. Yeah.
You can get better. This is such a beautiful conversation. I really appreciate your time. Where can people find you?
Yeah. So my website is lagyndr.com, like LAGYN doctor.com. On Instagram at Dr. Dr. Iris Kerin Orbuch, IrisKerinOrbuch at Dr. Iris Kerin Orbuch. They can find my book on Amazon or wherever, Beating Endo. We do consults across the country. We love out-of-state patients. Like, we can really help you. Like, we've figured out a way for patients to come here for surgery and it to be like such a positive experience, and then we continue caring for you after. And my phone number is 310-651-7333. And I have a new associate, Dr. Alcata, and the two of us are doing, like, if I can say, kick-ass work to help those with endo.
Yeah. Oh, I feel that. And in our show notes, whether you're watching on YouTube and listening, we'll also include how to get on availability to watch that PBS documentary, because it's a showstopper and very, very touching.
Yeah.
Okay. Now we'll roll out. Thanks so much for listening, everybody.
My pleasure.
Please be sure to like, follow, review, and share this episode. This is it's medicine. It's good medicine, and we need it all. Thank you.